Hello, and welcome to the podcast. I'm Tama Wagner, the director of the St. Joseph Community Alliance. The Community Alliance is a group of leaders who are focused on making St. Joseph a better place through the Community Alliance work of the Imagine St. Joseph 2040. Included in the Imagine St. Joseph 2040 is investing in people. And one of the best things that we do in St. Joseph is a community health needs assessment that Mosaic Life Care is required to do every 3 years. Marcy George works for Mosaic Life Care, and it's her responsibility to get that community health needs assessment done and then to implement the plan for the community health needs assessment. Thank you for joining me today, Marcy. Why don't you tell me a little bit about what the community health needs assessment is?
The Community Health Needs Assessment is an IRS requirement. It came about in the Affordable Care Act, and what it does is require all nonprofit hospitals to get feedback from their community, the one that they serve, as to what they feel are the top health needs in the community that the hospital should address. It does have to be done every 3 years, and as part of it, the hospital needs to put together an implementation action plan around those top 3 health needs, and then we need to make the action plan and the entire assessment available to the community so that anyone can look at it and see that we have done it and what our plan is to address it.
So this is a very serious thing. The IRS requires it. It's a federal government edict that all community hospitals, our nonprofit hospitals, participate in this. And so this year, what are the results of the community health needs assessment? What did the community say we need to be focusing on in St. Joseph?
Well, I also wanted to say, too, that although this is a requirement, it's a good thing for nonprofit hospitals.
Absolutely.
It provides a roadmap for these hospitals to decide where to put their time and resources, and it brings us together with the community. This is what they want us to do. This is what we're going to do. And that inspires trust between us and the community we serve. In this latest completed community health needs assessment, which was actually just posted on the website July 1st, so it's pretty much hot off the press, the community indicated that mental health and substance abuse was the #1 health need in our community, which is really no surprise because it has been in the top 3 since the community health needs assessment was brought about. And that was 2012. So it was then, is now, and continues to be a serious health need in our community. Second was access to and cost of healthcare. And third was obesity, which obesity has not been in the top 3 for the past 2 cycles. So I think that I don't think that obesity improved dramatically in the last 2 cycles, but I think there were probably just other things that were top of mind to the people in our community. I think that obesity has come back to be top of mind, particularly childhood obesity.
Mm-hmm. So as you said, mental health and substance abuse, there's no surprise there. It's included in the Imagine 2040 finding solutions to mental health issues. It's not just a local issue, it's a national issue. I think last time I checked, we were about 20 providers short, social workers in the community. It's one reason Missouri Western is considering a grow your own social work kind of program and offering a master's in social work program. It really is a critical need. And so it's so beneficial to the community that it's a focus of Mosaic Life Care, because Mosaic is kind of our big engine in this arena. So tell me a little bit about what Mosaic plans to do in this space to help move us closer to the goal of having enough resources to provide mental health and substance abuse services.
Well, ongoing, we will continue to financially support the agencies in our community that provide mental health services, such as the Center and Colby Puckett Center for Healing, which addresses substance abuse. These agencies provide huge help to people in poverty. But we've been doing this all along. There are some new things. We have become very, very involved in the Behavioral Health Alliance, which is a community program that brings together many different agencies, including the center, but also including the school district. So there's a wide variety of people involved. I do think, and this sounds a little cynical, but oftentimes these alliances are started and they really don't accomplish much, but this one actually has. The summit that they pulled together was very good, and we got a lot of favorable response from that because it really helps the providers of these services. We are also re-implementing the fourth grade challenge. We were not doing this program for 2 years during the pandemic, but we are going to bring it back into the schools. And as this is a program that teaches fourth graders how to eat healthy, how to exercise, the dangers of smoking and vaping. But we also, right before we quit for 2 years, implemented a mental health portion of it. And the kids loved it. The teachers really loved it because it helped calm these kids down. We tackled subjects like de-stressing before an exam, things like that, because just because they're only 10 doesn't mean they're not under stress or have some kind of emotional problem. So we are going to really try to beef up that mental health portion of the fourth grade challenge to try to reach that younger audience.
So full disclosure, because anybody who knows both you and me probably thinks this is funny that we're just sitting here casually talking about this, because we've known each other for years. We used to work on this subject matter together at Mosaic. And so we've kind of been in the trenches for a long time on these issues. In fact, the award behind you, the Foster G. McGaw Award, we won many years ago for the work we did in this space of community benefit. And when the fourth grade challenge was initiated, we purposely selected fourth graders because when you reach that age, you can make some decisions on your own and you can do some things on your own. And so it was a very purposeful decision to look at fourth graders. And the Behavioral Health Alliance is getting ready to do another summit this fall. So that'll be beneficial as well. And I think that the Alliance also does a good job of just bringing all the players to the table to make sure everyone is on the same page and that we're working in the same direction. So great news about the fourth grade challenge coming back into existence. If someone would like to volunteer to be in the fourth grade challenge, I think you've described it in the past as controlled chaos. So if you like controlled chaos and helping fourth graders with some coping skills and some life lessons, how could someone get involved and volunteer for that program?
They can call me. My cell phone number is 816-262-8948, and I will be happy to provide them with many volunteer opportunities with the fourth grade challenge. We always need help. There are a lot of kids in each session, and we only have 2 people managing each session. And you get 60 kids in a gym with 2 people. It's a lot to manage. So volunteers are highly appreciated.
I remember those days, but I think I could probably use some of those coping skill lessons to go back into that situation. Because yes, it is controlled chaos, but it's such a great program, and I'm really happy that Mosaic recognized that again, and that it's coming back into fruition. I know it's a lot of work for you. Implementing it is not an easy thing, but I think it's such a great thing for the community. So with the community health needs assessment, again, you gathered feedback from stakeholders and you did an online survey. So how many people were consulted about this, and uh, how can they follow up on the work? It's on your website, I think you said.
It is. The entire assessment, including the implementation action plan, is on our website, which is mymlc.com. But we did use a third party to help facilitate the assessment, because that's best practice, so that no one can ever say that we skewed it to maybe make the top 3 things that we would prefer or that we're already doing a lot about. So actually the community can weigh in and say that we need to address anything that they want. I mean, we really have no control over this at all. The third party that we consulted with was Crow, and they do many community health needs assessments. But they did key stakeholder interviews with 24 agencies in our community that serve all of the populations. A lot of them are underserved populations, so we really got good feedback from them. But there were also groups like the school district, the police department, the sheriff's department, and the health department. We are required to always be lockstep with the health department on this assessment. We also did a community online survey and got about 680 responses. So that's a good response.
That is a good response.
But when it came down to it, it was perfectly clear that mental health and substance abuse was going to be the top health need.
Yeah, absolutely.
Not only from the interviews, but also from the community survey.
Right. And I think when we do our biannual community survey, it's top of the list as well. And I think I'm trying to recall what the number was, but it's over 60% of respondents recognize that mental health and substance abuse are in crisis, and they support solutions to address those. So I think everybody is on the same page on that. So the other thing the community health needs assessment addresses is access to care. What do you have in your implementation plan to work on that issue?
Well, we provide support to organizations that improve access. We provide financial support to Social Welfare Board, and that is pure access, because anyone, regardless if they can pay or not, can receive healthcare at Social Welfare Board. It's a free clinic. It's one of I think it's the only one left in Missouri, free clinic.
I think you're right, yes.
We support them. We provide them with an APRN that we pay for entirely, plus a tech, and we pay their electronic medical record fees every month. So we do support them substantially. We also support Faith in Action, which is a faith-based group that gives people rides to their doctor's appointments. So that does help improve access for those that, for one reason or another, do not have anyone to take them to their doctor's appointments. Regarding the cost of care, I think that Mosaic has done a good job over the past years of improving our charity care policies and our financial assistance policies. They are very, they go up way above the poverty level, which was not always the case. But really, I think that we need to have more of a conversation too around cost of healthcare to see if there is anything else that we can do that should go into that implementation action plan.
And that's probably a national conversation as well. So I guess my last question, Marcy, is, you've been at this work about a decade now, and you've done a lot of work in this space. Do you think that the community health needs assessment has helped this issue or this community benefit space? Has it helped it? Has it improved it?
I do think it has. I think that in general, Heartland / Mosaic has always been very invested in the community. I don't think that we have a specific problem with directing our resources toward the community. However, I don't think that every nonprofit hospital is always going to listen to the community and have them decide the way they should spend their money. Being a nonprofit hospital does not mean that you do not make a profit, because you do. But I think that other nonprofit hospitals might consider just plowing those profits back into the hospital itself for equipment, employees, that sort of thing is enough. This forces all nonprofit hospitals to actually listen to the community they serve and get the feedback of what they think is important for that hospital to focus on. And I think that has a lot of value.
Great. Well, we appreciate the work that you do. We'd encourage everybody to visit mymlc.com and take a look at the Community Health Needs Assessment. Volunteer for the 4th Grade Challenge. Get involved. It's a great program. And Marcy, thank you for being on the podcast. It's always nice to see you.
Nice to see you. Thank you for having me.
Absolutely. So for the Imagine 2040 podcast, I'm Tama Wagner. Thanks for joining us.